Hi, my name is Dr. Vazquez, and I'm from Palmer Premier Dental, and I'm here to answer any questions that you have regarding dentures. So denture is an option for patients that are not able to get implants in their and to replace all teeth, all missing teeth in your mouth. So all the uppers or all the lowers, so that patients can chew functionally and speak and feel confident and smile. All general dentistry does dentures. Then there's prosthodontists that does dentures. So those are the two dentists that does dentures. Dentists will only recommend dentures if it's the last resort where all the teeth has to be removed from your mouth. Whether you have periodontal disease, that structurally gum disease is probably one of the biggest indications to get dentures, because you have no more foundation to hold the teeth in place for you to chew and function. Therefore, that's what the indication would be. The alternative for dentures is a partial, which is only some. If you still have some good teeth in there, then we give you partial. Partial dentures are just replacing segments of or missing a couple of teeth in your mouth. And if you're not, if you're not an implant candidate, then partial denture would be an option. Okay, that's for some teeth that are missing, not all teeth. The other one would be we would do a permanent denture, which is if you can place a couple implants in, then we can still have it a denture, but it'll be a snap-in denture. So in our office, we give you the best. We don't really have like a type of denture. We work with great labs that will only give you the best material. We want to make sure that you're happy with the quality that we give you. So I know that some offices have different quality that you pay for, but in our office, we don't. We only give you what's best, what's good for you in your mouth. The base of a denture is made of acrylic, and then the teeth are made of porcelain. So they look like your own teeth. We want to make it as natural as possible. And in regards to comfort, we will work, everyone's different, everyone's ridge is different, or ridge meaning bone is different. So we would make sure that it's comfortable in your mouth. So that's what they're made of, is acrylic and porcelain. So first is we would remove all your teeth. Then we would do a bone graft. Bone graft is very important because once teeth is removed, there is no bone missing in those areas where the teeth are missing now. So we would definitely repack all the bone back in each of those sockets. Then we would graft you and make sure and suture you back up. Make sure the whole area is nice, clean of any infection. And then we would give you an immediate denture that day. Immediate means it's a temporary denture so that you'll heal. And then we will give you a final, which is called a complete denture. And that's when everything is healed, your gums is healthy, and when we will give you a brand new denture with porcelain teeth. Getting dentures is not painful. It's less painful than having your periodontal disease in your mouth. Okay, imagine all that bacteria is going to your bloodstream and that your gums is inflamed. It's definitely less painful than having that in your mouth. We have three options. We have local anesthesia, then we have nitrous with local anesthesia, then we have Valium that will help you, and then with local anesthesia, and then we would have triazolam with local anesthesia. Dentures is like a little plate that's in your mouth. So it's like wearing a night guard all the time. So we want it to be comfortable in your mouth. At the beginning, it's like a learning process for you. But that's why we give you a temporary denture first, so that you will learn how to use your denture. We will try to make it as comfortable as we can for you. At the beginning, it would be a little, it's a work in progress, I would have to say. But I have many patients that after, it's just, we say, read something. So it's like learning how to speak again when you're young. So words The more you say the words, the more you read out loud, the easier it gets for you. Definitely you would have to cut up your food, but you would still be able to eat, enjoy the foods that you like. Drink water, no, you will not have any problems with that. So the best way for dentures to clean it is at night when you remove the denture. Yeah, we definitely have denture brushes that you cleaned. There are denture little tablets that it fizzes up. You put in a little container, you clean that, and then use denture brush to brush off all the excess food or anything like that to make sure that there's no bacteria on there. You would definitely have to make sure you brush your gums. It's like massaging your gums. And then you have to see us. I would recommend every 6 months, so that we make sure that the denture doesn't put a lot of force on your jawbone that causes like fungus to grow in your mouth. It's called candidiasis. So you don't want to do that. Okay. So we want to make sure we see you at least twice a year. Dentures is like teeth. They wear, like every time you eat, you chew your natural teeth, it does wear. So it all depends on each individual, but it should last you about 5 to 7 years, and you would have to get a new denture. That is very easily. You can come to our office. We have a 1-day repair. If you come early in the morning, we take an impression, we take your denture, we send it to a local lab down the street. Then they come, they pick it up, they fix it, and you have it later in the afternoon. It's a work in progress, so it would take about 6 to 8 months for you to to get used to having a denture. So first is insurance does help. Some plans do help pay dentures. So I would advise you when you purchase a insurance plan to look into that option. And then in regards to the cost of the denture is very minimal. The health of your mouth is more important. So just we want to make sure we have financing options here. We definitely want you to come in. We will work in every option that we have to give you what's best in your mouth, and restore back your functionality and your smile. Well, I hope I'm able to answer all your questions regarding dentures. And I'm again Dr. Vazquez, and please give us a call at Palm Harbor Premier Dental at 727-249-0460, and hope to hear from you soon.